Simple and to the point.
Hey everyone, thanks for joining. We're going to get started in just a minute. We're going to let people keep trickling in. We'll get started in a minute or two. Welcome everybody. Let's maybe give people like another minute and then we can start. Okay, so I think we might. I think we'll go ahead and get started. Yeah, so thanks everybody for joining us. We're really excited today to welcome Dr. Sweta Chakraborty. So Sweta's she's a risk and behavioral scientist. She's a globally recognized climate change expert and communicator. She works at the intersection of science, policy, and evidence-based communication. You might have seen her on news channels talking about COVID-19 or the climate crisis. She's the president of US operations for We Don't Have Time. And if I guess if I read the rest of your involvements and contributions, we might run out of time. So maybe we can just get started with I guess hopefully an easy starter question, which would, how did you first get involved in the environmental movement, and what drew you in, and what point was it when you realized how globally interconnected the climate crisis was?
Oh my gosh, that's exactly how I worded too, just how interconnected it all is. Complex as hell and really interconnected. So firstly, thank you all so much for having me. Thank you for coming and engaging with me this afternoon. I woke up slightly under the weather, so I'm apologizing in advance that you might see some tissues and some sniffling, but I'm here and I'm really excited to have this conversation with you all. So thanks for having me. So it was actually not my plan at all to be doing what I'm doing currently, which, as those of you who are somewhere along your education trajectory, about to embark on your career trajectory, I think you'll see a lot of plans as much as we intend to follow, and kudos to those who follow them. When opportunities come your way and when you begin to veer off course, see that as an exciting pivot potentially, because it's what happened to me. I was going to be a professor at Columbia University. This was my dream. So I was doing my PhD at King's College London, and I got an opportunity after finishing that to do a postdoctorate at Oxford. And I had applied behavioral science. So my PhD was in behavioral science, and I was applying it to understanding why people make decisions that seem to be not in their own best interest. It was a fascinating field of study for me, that people's perceptions of the risks that they face did not actually align to the realities of the risks that people are encountering day to day. And their decision making was off because of it. So that gap between perception and reality had a lot of implications for people choosing whether or not to take a prescription medication in accordance with their doctor's instructions to prevent acute or long-term diseases from occurring. So I was applying my PhD to understanding improved patient outcomes and why people were not complying to doctor's instructions. So I did my entire thesis around the role of trust. What role does trust play in actually influencing decision-making and ultimately behavioral outcomes? So that has nothing to do with climate, right? And I really thought that this was going to lead. The postdoctorate I did was in this very similar vein at Oxford. I was studying the risk regulation, pharmaceutical drug and biotech, medical device regulation, and litigation, and the history of how these two different systems interplayed, and why that resulted in drug recalls versus drug litigation. That was very much my postdoc. So to go from that to where I am now, you can imagine, was quite that pivot. So just be open-minded to the pivots when they come your way. So I finished my postdoctorate. I went to Columbia University. I was an adjunct professor, teaching a course on behavioral science, decision science. And I realized there's application of this field to other sectors, not necessarily just healthcare, not necessarily just sectors like pharmaceuticals and biotech, but implications for why there's a gap between perception and reality in environmental decision making, and across all stakeholders. So individuals in terms of like whether they care about where they live, what food they eat, access to water, um, all the way to companies, that are they really thinking through their operations and how their operations are being impacting negatively potentially the environment that they're conducting businesses in. And so I realized through teaching behavioral science and being randomly asked to teach a class on carbon sequestration, I knew nothing about that, what that was at the time. We're talking about 15 years ago. Wow, I'm aging myself. Yes, 15 years ago. And so I was teaching carbon sequestration, and I realized there's application of behavioral science to environmental subjects. And even though I didn't know what carbon sequestration was, I learned it. And the students actually brought a lot of knowledge as well. It was a master's course, so I was able to learn from those who have, many of whom had already been on the field and who had already been applying their education. So it was a two-way learning for me. And then once I realized what climate change was, quite honestly, it was one of those things that I couldn't turn away from. So as important as healthcare is, as important as everything that we are contributing our efforts to improving across society, from healthcare to food to water to where we're, urban design, all of these things are important. But I had to prioritize where I was going to focus my energy and my contribution. And once I learned about climate change and the reality of how fast we're warming, I couldn't look back. It was something that I had to work on. And I knew that behavioral science was lacking. The application of behavioral science is lacking anyway, especially in healthcare where it's truly helpful, but definitely in climate. So if we can understand why there's such a gap between individual perceptions around risk around climate and its ripple effects, like why people don't care, why sea level is perceived as too slow or too far in the future to act on today and now, then maybe we can actually begin to really make some headway, to really begin to identify some solutions and think about how to scale those solutions. So that's a really long answer to your question, but I think it gives a nice little background as to my academic kind of trajectory and how I moved from applying behavioral science from healthcare to climate, and how much more really needs to be done there.
Yeah, I really appreciate how you didn't, much like myself, I didn't necessarily set out to work in the environmental field, but eventually I found myself with some skill sets that can be applied to problems in environmental science. And once you see some of once you start seeing the atrocities that come along with climate change, it's hard to unsee, and it's hard.
Exactly that.
Yeah.
And that's another point, Dylan, that you just mentioned. As a behavioral scientist, that's important to remember is it's scary as hell, right? But that's a good thing in terms of mobilizing action. So it's so terrifying that we can actually use that to our advantage and not immobilize people. So the idea is scare the hell out of people, call it what it is. It's a climate crisis. It's a climate emergency. Let's get those headlines out there, but then don't end it there. And that's a lot of the issues with politics and media, is that it's just kind of us. And this is why we get accused, those that are working in the space, of fear mongering or scaremongering rather. And the idea is, well, yeah, but that is what it is. People can face the reality of the crisis, but then we need to give tangible, actionable next steps. That's really important. And along with that has to be hope. So the combination of ensuring that we have behavioral outcomes that are positive is to scare people to get their attention, because we live in a very complex, complicated risk environment, and we're saturated with information constantly. So to break through all of that and to draw attention to what requires prioritization of resources, we need to scare people, but then follow with hope, message of we can overcome this. These are the steps that we need to take. That's the kind of thing that we've learned through behavioral science too. So you'll see a lot of that combination of fear and hope.
And especially in the context of what's going on today, and especially in the Pacific Northwest, we've seen, like the last week, we've seen record heat waves and wildfires and droughts, and a lot of time when you see this covered on the news, people don't mention the word climate. They don't, or if they do, they don't necessarily know how to talk about heat waves and climate change together. That, like, you get the sense that they're related, but a lot of reporters are not caught up to speed on what scientists know today about the connections between droughts and heat waves and floods, and you know, that's part of why, like, a lot of the work that you do is so important, going on and actually talking to these people who are communicators to very wide audiences, and starting to get people to become more familiar with using climate change terminology and not leaving the word climate out of the picture when it's an important role when you're talking about something like wildfires.
Right. Yeah, no, and exactly. So one of the things when I was going through my PhD, they didn't train us on how to communicate. And I think that's improving. I'm curious to hear from all of you here how much communication is being integrated into your course. But for me, it was non-existent. And that's really a shame, but it's something that has become painfully evident now as we're in the midst of the climate crisis, how much scientists haven't been incentivized to communicate, to improve, and to consistently communicate, right? Because it's one thing to communicate and to communicate with your peers, but how are you collaborating with your peers and consistently coming up with messaging that is then being transferred to different stakeholders? The public is an obvious one, but how are you communicating together as a science community to regulators, to decision makers, to country delegation heads? Is the language being used similarly, consistently, and collaboratively? That's something that we have not done well as a science community. And I'm part of the science community, so I'm not trying to fire shots at us, but it's one of those things that we aren't perfect either. We need to iterate on and improve upon and get better at communicating. Because here's a lot of what I say when I give talks on this is we can't afford to be seen as a community that is not on the same page. And when we argue with one another in the public, it'll be familiar to you, this term as scientists, we create scientific pluralism. It seems like we are not in agreement despite the fact that there's consensus on something like the severity of climate change. When we're arguing over decimal points or what these scenarios might be in the future, and we're arguing over the likelihood of one scenario over another, when we know broadly it's going to be bad, but we're arguing over decimal points, what the public hears and what decision makers hear is, oh, they don't know what they're talking about. They're arguing with one another. And so that creates distrust, and that perpetuates distrust. And it allows the other side, those who are not necessarily have those science backgrounds, to talk and point at us and say, scientists don't know what they're talking about. Look, they're arguing with one another. So you should trust us because we're talking a little bit louder and a little bit more confidently about all the things that we have no idea about. And that's how the other side wins the communication wars. And that's something we cannot afford going forward. So for me personally, I wasn't trained in communication. It was something I did simultaneously as I moved out of academia. I'm still in academia. You never leave academia. For those of you who are going through this career process now, once you're in academia, you never truly leave. But I did pivot into science policy and public communication. And I had to train myself quite a bit. But I'd love to hear from some of you when we start with Q&A as to how well equipped you feel to communicate to the public. Because the one other thing I'll say is we're talking about a very complex risk landscape, and it's very interconnected. And that was a story that isn't told well because we work in our own scientific silos, right? So you have academics who are extremely intelligent and unbelievable communicators, again, within scientific circles. And maybe there's a handful that I definitely put on a pedestal for being excellent communicators publicly, like Catherine Hayhoe, like Tony Lazarowitz. These are climate communicators that I really admire. But broadly speaking, it's hard to tell this story because most academics are very siloed or there's deep knowledge in a particular vertical as opposed to having a broader knowledge. And that's just the way that's the way our training is designed. And so you end up, the people that talk more broadly end up being pundits or those who don't always have a scientific background because that's what the media is looking for. They're not looking for necessarily deep expertise when talking about the climate crisis. When you only have 3 minutes in a media segment to talk about what's going on in the world, they're not necessarily looking for deep detail around the nature of why ice is melting, but can we speak broadly on it? So that's the type of thing that we as scientists need to get better on and be able to tell the story from that broad eagle-eye narrative view. So the planet is warming, there's ripple effects that include food insecurity, water scarcity, increased infectious disease, sea level rise. All of these things are complex, interconnected. And how do we tell that story in a way that gives us that ability to be generalist when we communicate to the public, but still allows us to have that deep expertise in our particular discipline? And both of these things need to be done simultaneously. And it's not that one is more important than the other. We really need both. But I just, if you take away one thing from this talk, it's how important it is to be able to translate the work you're doing to an audience wider than your peers and the science community more broadly, and then to be able to tell the story much more generally. That is going to take our science community a long way in being able to get the action that we need across all stakeholders. And that's something you'll see from my career. That's really what I've been trying to do. And it was something that I've had to do. I've had to forge it because it wasn't necessarily taught to us, but curious to see if you're getting taught that more now. And here's hoping that's the case.
Yeah, well, one significant shift that I've noticed is that people, especially in the last couple of years or so, have sort of shifted to talking about climate change in the future to talking about climate change in the present. I think sort of earlier on, and people would use the word climate change is coming, like climate change is going. We would always use a future tense to refer to climate change, and now we're starting to become more comfortable with talking about now. We're talking about food insecurities now that are causing mass migrations, and we're talking about floods now. We're talking about wildfires now, and I think that communicator shift to using the present tense, I think, has been really effective at capturing people's attention over the past year.
Yes, no, I totally agree with that. So
yeah,
I think, sorry, go ahead.
Okay. And I was just going to say, I see a lot of similarities with the COVID-19 pandemic. Is that it's much like climate change. The COVID-19 pandemic required a global concerted response, and there's a lot of criticisms to be had about how the response was handled. But I think there's a lot of learning opportunities from how globally we handled the COVID pandemic, and I think we can learn a lot of lessons for how we should, or how we can best leverage our global cooperative skills to manage the climate crisis.
Yeah, so what I'll say with that is these two things are really inextricably linked, is infectious disease and climate change. So when I left New York and I moved to Washington, I was leading a think tank out of DC called the Institute on Science for Global Policy. And this is 10 years ago. And we were trying to figure out lessons learned from swine flu and Ebola in terms of how to proactively prepare against the next big global pandemic. And there's no such thing as a post-pandemic. It's just, again, a pre-pandemic. It's inevitable that another pandemic is going to arise. And so we need to take proactive steps, because we know that once a pandemic emerges, COVID-19 was a test run for something that could be way more lethal. And so once it emerges, we're really now playing catch up, and we're trying to contain something that is very difficult to contain. So our better approach to something like a pandemic emerging is to not let it emerge in the first place. And there's networks globally that look at this. There's the Global Virus Network, and I'm part of EcoHealth Alliance. I'm on their board. They're based in New York City. And the idea is look at surveillance, put all our energy, not all our energy, obviously, we need to save some resources for relief and recovery. But if we're constantly playing recovery, then we're not going to have the resources, or we're going to be stretched way too thin to be able to try and get the genie back in the bottle once it's already emerged. So what we need to do is prevent infectious diseases from ever seeing the light of day. And we do this through surveillance and mitigation. And we do it through a global cooperative network that includes partners in China. And you hear a lot of politics around things getting certain partners and countries getting vilified. And that is exceptionally problematic, because if we don't cooperate and collaborate with especially labs around the world in places that we consider hotspots, right? So certain countries, there's 17 mega diverse countries in the world, China being one of them, Brazil being another, India being another. And these are the countries where, because of the diverse ecosystems and growing populations, there's a likely possibility of a infectious disease emerging, because you see increased deforestation, you see increased habitat encroachment, you see temperatures increasing, and you have interaction with exotic animals that historically hasn't been the case. So as humans mess with nature, you're increasing the likelihood, the frequency and probability of mutation of viruses that otherwise are sitting inside the microbiomes of various exotic animals. But now we are messing with them. We are using them for wildlife trade. We're using them for consumption, and we're putting them in situations that they wouldn't naturally find themselves in. So when you have a bat on top of a pig, on top of a snake, on top of a whatever, you are creating these fertile breeding grounds for viruses to emerge. And the two trends that is just amplifying this is increasing global population and increasing temperatures. Combining all of these, we are looking at increasing likelihood of emerging infectious diseases. So I actually, when I first started working in Washington, D.C., we were looking at how do we reduce the likelihood of these diseases emerging? What do we need to do? And it's really sad to say that despite all of the knowledge gleaned from previous outbreak, MERS, which came from the Arabian Peninsula, Nipah, which is in Bangladesh and Malaysia, HIV, which came from Africa. I mean, we know where these diseases have and are likely to emerge again in the future. We have field epidemiologists on the ground all over the world. We have actual like Batmen in bat caves that go into bat caves and are taking samples from bats and keeping the different coronavirus samples in labs and just constantly testing to see where mutations are going. All of this is happening. It's not a bad thing. This is good. We need to be vigilant. We need to maintain our surveillance efforts all over the world. And this is the kind of thing that, despite all of our awareness and efforts, still resulted in COVID-19 emerging. And that is really problematic. It means we are not putting enough time, attention, and resources into proactive preparedness. And we're also, at the same time, not mitigating the climate crisis, because as the planet warms, you're going to see more deforestation, more habitat encroachment, more animals and disease vectors moving from the lower latitudes to the higher latitudes. And so it's these movements of animals and it's these interaction with animals that it tells the story of why infectious disease and climate change is so inextricably linked, and where we have failed as a proactive in our proactive preparedness. There's a role for science community to play. There's a role for policymakers to play and for regulators to play. But ultimately, we also need to communicate to the public, because all of this mutually reinforces itself. If we don't have the public demanding that protection against future pandemics, where will the political will be to actually push that policy forward? Because this is behavioral science again. When there isn't a risk that is obvious to people, we don't perceive high risk. So people are massively complacent when there is not a outbreak, for example. So you have a disease that is dormant. We're in pre-pandemic, and nobody cares. The majority of the public is complacent. They're not. And if you have a politician that says, we want to invest $100 million in preparing against the next pandemic, you can imagine people be like, what? No, protect us from terrorists. We just saw, a plane crash. We need shark attack protection. Things that are salient, that scare people, that the media covers, is what people demand their politicians to protect them from. But the reality is, we need to close that perception and risk gap so that the resources are directed towards protecting us from what we really are going to be encountering, which is climate change, its impacts, infectious disease, outbreaks. These are the things that we need to align perception and reality to, so we can allocate resources accordingly, because we can't afford for people to be complacent when there's no disease outbreak. And then, of course, when an outbreak happens, you get the public to say, what? How could this have happened? Why didn't we prepare for this? Well, because it's our brains. We're not wired to pay attention to risks that aren't in our face. And that's something that, as a behavioral scientist, I work on, and that's my contribution to this space. But every one of you, whatever your background is, whatever your expertise is that you're pursuing and studying, I encourage you to contribute to exactly this. Let's better help. Let's better communicate, of course, broadly. Everyone has a responsibility to do that. And let's make sure our resources are being allocated to the prioritization of risks that we're facing. Please take that away from this talk. We need to make sure that we collectively are doing that. If we're spending all our time protecting ourselves from shark attacks, wow, we have really missed the boat on what we really need to be concerned about going forward.
I really like your analogy about getting the genie back in the bottle, and it relates to climate change so well. Is that it's a similar analogy that I always hear is, if you have a kitchen, it's filling up with garbage bags. It's never too late to start taking out the garbage. You're just going to build up more garbage if you don't address it now. And
Exactly.
yeah, and the kind of the idea of hitting it, being proactive about it, being proactive about environmental degradation and construction. It kind of reminds me of the environmental movement early on in the 60s when the Cuyahoga River caught fire. And that river fire eventually, I guess, it ended up leading to the creation of the modern EPA and the Clean Water Act. And just last week we saw the ocean literally set on fire by a fossil fuel company, and and it kind of draws these parallels between the environmental movement in the 60s and the environmental movement today. And I guess I'm wondering your thoughts on whether you see that the tides have shifted from a policy perspective. Do you think, like, all of the environmental catastrophes we've seen over the last couple of years that seem to have been getting scarier or have do you think that that's actually getting people's attention? Do you think people have shifted in the last during the pandemic?
So, okay. So the question was, has people's attention shifted during the pandemic?
In particular, like the policymakers, the Environmental Protection Agency was created after a series of environmental catastrophes early on, and it seems like we're seeing parallels today. And I guess I'm wondering if we're at a similar inflection point in terms of
Yeah.
like.
Great question. Great question. So one thing we know from risk communication research, there's a CDC life cycle graph that illustrates this really well, is the best time to get public attention and policymakers to actually push through important efforts is post-pandemic. So again, I don't like saying post-pandemic. There's no such thing. We're back again in pre-pandemic, but it's kind of when let's say post-disaster. So you have this point where a disaster occurs, whatever that is. In this case, it's COVID-19 outbreak. And then you hear a lot from certain pundits and certain policymakers that we shouldn't be talking about policies and solutions going forward following a disaster outbreak, because that's when we need to be worried about relief and recovery. So it's almost one of these, and I'm not going to name politicians, but I know you know who I'm talking about. It's one of these refrains that you hear, which is, don't talk about climate change right now. Don't talk about future pandemics right now, because you're being insensitive to the fact that we've just faced a disaster and there's people suffering, and we need to worry about helping those people right now. That is completely inaccurate. That couldn't be further from accurate from a behavioral science, cognitive psych perspective. We are most vigilant and most likely to be aware of what is going on right after a pandemic, in the middle of, so post an outbreak, during the outbreak, and as the outbreak is winding down. As it's winding down, we're less likely to pay attention to what we need to do to be proactive against preventing another similar type disaster. So it is really critical to take that advantage of that window from as soon as an outbreak happens, to taking advantage of that, to the fact that we have everyone's attention and policymakers want to show that they're action oriented, to identify solutions and to push them through. So that's why all the examples you gave previously, that's why it happened in the timing that it did. And for now, this is why we're getting the funding that we're getting for proactive prevention for the next pandemic. This is the time that we would be able to get those wins. And in terms of additional policies that we're seeing, well, I think one of the most problematic ones, and I see questions come through in the chat related to this too. One of the most problematic ones is, so there's two, right? So one is there's definitely attention that this is an issue. We have people's attention. We need to change our habits as individuals. We can demand less of these products that we really don't need, that are potentially causing these infectious diseases to occur more frequently, like exotic wildlife goods and foods. So that's one thing we can do as individuals, is change those practices and behaviors. We can also and demand the businesses that we interact with to no longer provide these types of products. We're part of this ecosystem, this public-private ecosystem where we consume from private companies and they are supplying us with what we demand. And at the same time, we vote in our representatives who are incentivizing private sectors one way or the other through taxes and other incentives. And so we have to use our power, particularly in this time of heightened awareness, to put pressure on the public sector, to incentivize private sector to stop behaving badly, and at the same time, us to change our practices so there's nothing for the public sector to fulfill in terms of our needs. So remember that we are part of this ecosystem. So that's one. This is the time to take full advantage of the fact that we have everyone's attention. So to make those demands really clear, and to move funds from that relief and recovery to proactive preparedness. We cannot fit the genie back in the bottle. And so it's really important we do that. Now, one negative that's coming out of this is what we're seeing as this lab leak theory. So this has come up in the chat, so I can address this briefly. As somebody who works with EcoHealth Alliance, and I know Peter Daszak, who is the president of EcoHealth, who's been really vilified, so has Tony Fauci, unfortunately, who's a big supporter of EcoHealth Alliance and much of the work that's going on, the global network that is working together to prevent these diseases from breaking out. To point fingers now is also dangerous because we need collaboration more than ever. These diseases are going to come again in the future from places like China, from places like India, from places like Brazil, from places like the Arabian Peninsula. And if we don't have good relationships with scientists around the world, and the standard that is set in these laboratories, you as fellow scientists will know, is really high. And so if we don't have good standing relationships and collaboration efforts, we're really shooting ourselves in the foot as a global collective. What's going to happen is with continuing to propagate these theories like this lab leak theory, drawing attention to something like that, which is less likely than the reality of what most likely occurred. I agree, we still need to investigate and figure out exactly where this disease came from, this particular strain of coronavirus, exactly what the source of it was. And remember, it's taken years to figure out the exact source of infectious diseases in the past, including HIV. So it may take some time, but just because we don't know doesn't mean that we point to lab leak theory. And it's dangerous. It's dangerous because it's taking attention away from the reality of what's going on, which is we have increasing zoonotic disease, transfers of viruses occurring from animal to human, and it's our bad human behaviors that's causing these viruses to outbreak. If we don't do that, and if we don't continue to collaborate with partners in higher risk parts of the world that are mega diverse and more likely to result in an infectious disease outbreak, then we are doing a massive disservice to ourselves. So I just wanted to make that point because I know it came up in the chat.
Yeah, thanks. And I want to pivot a little bit and talk about like environmental jobs because we have a lot of early career folks in here, and we kind of touched on this a little bit about the massive amounts of funding that have sort of been given to the COVID response, and I think to some extent we're seeing something similar with climate change. That there's lots of funding going into universities and research agencies and nonprofit, and even now in government we're seeing climate jobs pop up and up. And I guess we're wondering if you have any advice on where the best place to look for environmental jobs are. Like if you're, do you have like a network that you turn to? Do you have, do you mostly rely on your networking that you've done in the past? If you were to go back and try to enter this field all over again in 2021, what would you do?
Okay, so I love that question, and I hope I can provide some resources for you all here. So I just want to make sure I don't miss this one question. The doctorate in public health, who is looking for, is there an area in climate change that would be a good fit? Yes, absolutely. Increasing allergies are happening because of longer spring and summer months. And so adults who have not had allergies their whole life are experiencing adult onset of allergies for the first time. You'll see that there's an increasing need for those to close the gap between ear, eye, and nose, that particular area of medicine, and the public health implications of that. So we need medical doctors, we need public health experts to talk broadly about, when it comes to climate and health, to talk about what this means for chronic diseases and allergies, because many will be increasing as it relates to the climate, and again, infectious disease outbreaks. So there's two major, I mean, there's much more than this too, but two major areas in public health and medical expertise is increasing adult onset of allergies, what it means for our human bodies that have never lived at this temperature point for millennia. And now all of a sudden it's like we're on a new planet. We have to remember this. We as a species have never existed at this temperature point. So there's serious implications for our physical health. And then what does that mean for increasing infectious diseases? So two of those fields, definitely there's a lot of opportunity in to pursue if you're looking at health. Remember, sweat doesn't evaporate off our bodies at more than 95 degrees Fahrenheit. And so what are the implications of that? What is the health of workers? That's a public health issue as well, especially those that are outside exposed to heat for long periods of time. What does that mean for the military? For those of you who are interested in national security, you're in Baltimore, you're so close to Washington. Some of you might have relations to the military that you're considering pursuing. Well, there's an increasing number of Black Flag days, Black Flag training days. Some of you might know what that means is these are days the military can no longer train because it's too hot. And so it's too dangerous. So because of that, where our military is underprepared. And there's already conditions that our men and women in uniform are facing abroad that are even made riskier because of climate change, because of increasing heat. So that's another angle that you can look into from the health perspective. That's definitely also has the national security component. Okay, and in terms of resources, so this is something that is relatively new, and I hope that as young people, you'll take full advantage of it. It's called We Don't Have Time. It's a application. So it's an app on your phone. It's also a website. So please download it. It's totally free. It's a tool that's completely free to use. And you'll see on there that it's basically a one-stop shop for everything in climate change. So you can get news. So it's a news feature related to climate. And it has every organization that is not for profit has a page. We're working on getting everyone's page activated. And this is from World Wildlife Forum to the NRDC to World Resources Institute to name a think tank, name a environmental group, where it's on there, and it allows you to engage with them. Okay, so it's an exceptional tool to be engaging with these not-for-profits. It's also private companies. So private companies from Amazon to Facebook to every private company that has some vested interest in climate or is behaving badly in climate also has a page and can be engaged with through having your own profile on there. So it's an opportunity to reach out to those to your peers that care about climate, and it's an opportunity to reach out directly to organizations and start the conversation. Say something along the lines of, I'm so-and-so, I'm graduating, I care, where can I like add assistance to your particular work in climate? So, I mean, some groups are obvious because all they do is climate, but there's definitely companies on there that might be a little bit more surprising, but you can contribute incredible value to. Like Unilever is a multinational whose CEO has been a true leader in talking about going fully renewable. And so L'Oreal is a makeup company that is doing similarly. And I know all of you know many, many more. And so it's an opportunity to really be able to start that conversation, pinpoint where you can add some value in these organizations and companies. So that's one resource I definitely want to make sure you all have. I'll put it in the chat so you can see it. It's called We Don't Have Time.
Very aptly named.
Yeah, because you're not the first people or young people that have been asking where to connect the dots. And what we'll be doing also with We Don't Have Time is connecting those looking for work to those who are looking to hire. So that's a function that's coming as well. But right now you can organically make the connections and have the conversation. The one advice I will give you, everything that has happened for me in my career has come through my network. It really does come down to reaching out, having conversations. People need to know who you are and what you're passionate about and what skills you can contribute. The best way to do that is to reach out, to look on your LinkedIn. Everyone should have a LinkedIn profile. There's absolutely no reason you shouldn't start filling that out, and then connect with people through We Don't Have Time, through LinkedIn. Make the reach, make the ask, and say, can I get 5 minutes of your time? Take them out for coffee, buy a cup of coffee. It's the best $2 to $5 you'll spend in your life to get face-to-face time with somebody that's interesting. and have the conversation. They will then connect you forward. That's the way to do it. It's truly networking, and it doesn't have to be going into a huge group of people at a conference and having your resume, walking over to somebody, handing it. I know that can be really, obviously it's COVID, so it's scary in that sense, but it's not for everybody. Not everybody's personality is into going up to people randomly and pitching themselves. I appreciate that, but networking doesn't mean that. It doesn't have to be that. Networking, you can fully take advantage of the existing network you have. You're at Johns Hopkins. What an incredible place to kick off from and start. You can see who's graduated from there. You can see former alumni. And if you can't reach them, reach somebody in their office. So shoot a note and an email to somebody, and just make the ask to have that conversation. Just a chat will open your eyes and will give you the next lead, and just keep doing that. It will be your network that leads. I think there's a stat on this. It's like 95 to 99% of your next work opportunity will come from exactly this process. So it's very worth it. I'm not saying don't apply to jobs. Of course, that's there too, but take advantage of the networks, have these conversations. There's more people out there that are willing to help you than there aren't. It's just a matter of letting them know you exist and you're looking for something. So please do that. Be active.
Great advice. I think we'll do one more question and then we'll turn to audience questions. So the question I want to end on is, how do you stay positive and optimistic about climate change when there are so many days and moments where things feel dire? And I can share my personal answer to this, is that I usually turn to my fellow colleagues and eco warriors for inspiration. And I think feeling like you're not in this effort alone really makes a difference. And whenever I do feel like overwhelmed or like we're fighting an uphill battle, I call up one of my eco warrior friends and we just chat. And not feeling like you're fighting alone in this really makes a difference for me. So I'm wondering how you stay optimistic.
So I love that question, and I'm glad we're pivoting to solutions and how to stay positive, because I think that's really critical. We talked about physical health as well, and how you can contribute to medical and public health careers and opportunities, but mental health is a big part of this. Eco-anxiety is a real thing, and that's going to be a place of, unfortunately, increasing opportunity. So this is something to contribute your skills to as well, to think about early on, because we definitely need more skills to look at people's mental health, especially around a rapidly changing environment around us. I'm going to also link your question into one from Sakib I see in the chat. So Sakib was asking if we're using the term correctly, climate crisis. It's fun you say that, because I'm on this climate comms call every week, and it's some people you'll recognize, perhaps others who are really trying to move mountains from behind the scenes. So it's like a Jane Fonda, for example. It's Tim Kelly, who was the president of National Geographic, who started Earth HQ. I'm on his board. It's David Fenton, who's a famous activist. These people every week have a call, and it's also the heads of some of these media corporations, and they're trying to actually address this issue that was put in the chat. Are we calling this the right thing? Can we rebrand climate change, and can we rebrand 1.5? Because 1.5 doesn't really mean anything now either. 1.5 is where we hope to max out at by the end of the century, but the reality is, even if we do everything we do, we're still going to max out at 2 degrees, still not 1.5. So what do we call it, where again it's actually accurately addressing the reality of what we're facing, and without immobilizing people? So we're actually talking about this planetary asphyxiation. That's interesting. But we're actually, some of the best comms people and activists and media personalities in the world are actually working on this as we speak, to recharacterize what we call climate change, to whether or not is it climate crisis? Is it climate emergency? Is it 1.5, the runaway point, the tipping point? Great question. I look forward to I'd love for you all to follow me on LinkedIn. I'm easily accessible on LinkedIn, on Instagram, and mainly on Twitter, but I will keep you informed as to where we go with that. You'll probably see it before I even put it out there, because it'll be a massive overhaul in how we talk about climate, but keep an eye on that. And I will keep you updated as well, primarily on my Twitter, which is Shetta C. I'll put it in here. Okay, and as for how do I stay, oh no, that's not it. That's not it. My name always gets auto-corrected to, I always get that auto-corrected to Sweat. The irony, I work in climate change and my name is Sweat.
And it's sweating.
Yeah. That's my Twitter, everybody, and this is my Instagram. So I'll keep you all up to date on where we go with adjusting how we talk about climate in the mass media. How I stay positive is, okay, so if anyone's seen my TED Talk, it starts with me saying, I'm terrified of having children. And it ends with, if you make it to the end, it ends with, I do want to have children. I will have children. And I look forward to a future that's actually way better than anything we're experiencing now. If we do this correctly, if we actually do this well, then there's going to be some extent of suffering. Okay. So, yes. We want to stave off the worst case scenarios of suffering. We want the least amount of people to be harmed as possible. And we want to make the transition into this new temperature point as with little suffering as possible. But ultimately, we're talking about large swaths of land that will not be inhabitable. And my family is from Bangladesh originally. And I know it's personal to me. That's an area of the planet that just there's no way that will be a livable part of the planet. So there's going to be movements of people, mass migrations of people, and we need to, as humans, we need to minimize how difficult that is going to be for those that just can't stay where they currently are. And there's of course going to be, at best, if we can do this with minimal fatalities, there's still going to be trauma that comes from uprooting and moving, right? So at a minimum, there's going to be some suffering, but we can stave off the worst case scenario. So if we can just ensure that we don't pass 2.2 degrees Celsius max by the end of the century, we can still find a planet that is accommodating of everybody on it. So that's one. And our population will start to decrease if the trends continue at some point, but we're going to be reaching 10 billion people on the planet by 2050. That's really intense too, because it's not so much about, it's not about, what countries have less people than others. It's as a global consumption population, how much of the resources we're using up collectively. So the combination of 10 billion people on the planet with existing areas no longer habitable means a lot of change up that we need to anticipate, but we can be proactive. We can predict better than we've ever been able to predict before. We have incredibly intelligent people working in critical roles at NASA, at the Meteorological Society, at different organizations that do a lot of predicted modeling in terms of where we're going to be, where we're going to need to focus our resources sooner than later, where we can begin retreat from vulnerable coastlines. There is a lot happening that isn't getting enough time and attention. And that's partly why we're experiencing this eco-anxiety, is because we really tend to hear just a lot of the bad news stories, because it's the headlines. So another thing we need to remember is that we're disproportionately reporting on the negative, and we need to recognize that a lot of positive is happening. So if you actively work in climate, you'll inevitably come across the solutions. If you join this app, We Don't Have Time, you'll see that 70% of what is being put into the app is actually very positive. And the idea is like, okay, yes, we're in a crisis, we're in an emergency, our planet is being asphyxiated. I really like that, Sakib. I appreciate that you put that forward. But 70% of the effort that's going on, as if this app is a microcosm of what's happening more broadly, is solution oriented, is positive, is the sharing of ideas across individual users, across not-for-profits, across for-profits. The sharing of ideas and the scaling of solutions is what I spend my time and attention on, because ultimately we need to scare people, and that can cause a lot of mental anguish, and it has caused me a lot of strain. It's why I had that fear of, can I have children or not? But ultimately, it's the hope, and it's the solutions, and it's the sharing, and it's the collective effort, it's the amplification of effort that is then giving me the hope to move towards not only continuing to doing what I'm doing, because there's nothing else I can do. Once you know that our planet's on fire, we have to contribute our resources to it and our skill set to it. And it's got me to the point where I'm like, and I can have kids. So if somebody like me can go from being completely terrified to hopeful, there really is something to be said for the effort and the solutions that we're getting behind. So I get a lot of hope from that. I get a lot of hope from seeing what's going on globally in younger generations. And again, I don't want to sound like I'm 50, my gosh, but I might be closer to 50 than some of you that might be earlier in your school. But looking and seeing what young people are doing, like Greta and other activists around the world. I'm close to 0 Hour. We have Jamie Margolin on the board of We Don't Have Time. She started 0 Hour. There's Sunrise, of course. Know many young people that work with Sunrise. And there are other groups in addition to Fridays for the Future, in addition to Fire Drill Fridays, which is also Jane Fonda's group, which also involves a lot of young people. I'm seeing so much collective effort, and we need that. We need people on the ground that are doing what's needed to put the pressure on policymakers to change their ways and to act more urgently. And then we need multilateral efforts. We need the UN. As problematic as the UN has been in terms of actually holding countries accountable, in terms of actually implementing some of the solutions, it's still an organizing body that can bring together what is a global collective consensus of what needs to happen. That's critical. So we need multilateral efforts from the UN, from the World Bank, from the IMF, all the way down to that little girl sitting in front of Swedish Parliament holding a sign that went viral and sparked movements around the globe. The combination of ground up, bottom up activism and top down unilateral efforts from country delegation leaders will be what tips us to the point where we don't reach more than 2 degrees Celsius by the end of the century. And we can all look forward. Honestly, that'll be a cleaner environment. Imagine the amount of innovation that's going in to make it cleaner, just generally. We go renewable. We don't have to worry about wearing masks from pollution. I'm again from where I'm from in Calcutta, my family in Bangladesh and Calcutta, India. It's you don't want to go outside and breathe in the air. So I look forward to just a cleaner future. And you don't need to go to India to see that. There's plenty of places in the United States. But the point being is that if we do this right, this could actually end up being one of the greatest outcome stories of our species since the dawn of our species. So here's hoping.
Yeah, it's like a reinvestment in our future. We had an audience question that's kind of like on that topic. So someone asked whether we as individuals can contribute towards addressing climate change on a personal level. And what practices do people follow? And
so one more time, what practices do people follow? Sorry, there's a lot of messages coming into.
Sorry, I'm having.
No, it's okay. I want to apologize to those that I don't get to, because I appreciate that people are taking the effort to write out significant messages to me, and it's a lot to read while also answering the questions. What I'll try and do, if I can direct this to Roshni to please just collate what is being put into the chat and email it to me, and I'll do my best to respond if I don't get to in this chat, mainly because there's a lot coming in and I really do appreciate everybody's engagement, and I don't want you to think that I'm not responding to it. It's just a lot, and I know we don't have much time left. So please just collate, send it to me, and I'll do my best to get back to everybody.
Sounds good, Sweta.
And Dylan, sorry, if you don't mind repeating what you just asked.
Yeah, so people are asking about what can we do on an individual level. So that there's a lot of it we're sort of waiting on government responses. We're waiting on funding to come through. But if you're just going about your day in public, like how can you start to bring practices to your daily life that help effectively communicate what's going on in the climate crisis, and also making sure you're not exacerbating impacts at your community level?
Yeah, that's a great question, and that's probably the one I get the most. So what I'm going to do here, I'm not going to be able to get through all of it in the time that we have, but I'm going to share it's easy to find, but I'm going to share my TED Talk in this chat, because this is kind of me answering this question. It's about 15 minutes. So if you want to get a little bit more detail about what I'm about to say, then check this out. It should sufficiently answer this question for you if you want some more. So
it sounds like you could probably teach an entire college course on that question.
Well, I do. I do actually teach behavioral science as a course. And I did at Columbia, and I do as a guest speaker. So yeah, maybe that's what I'll do for Johns Hopkins too. Let's see where this goes. And I see somebody brought up nuclear. I do think nuclear is necessary to to wean off fossil fuels. I don't care about nuclear one way or the other. I have no relationship to anyone in the nuclear industry whatsoever. But what we did was we hosted a virtual conference with experts on nuclear from around the world, mainly university professors, to reduce any sort of bias and to reach some consensus on the role that nuclear needs to play in reaching net zero. And overwhelmingly, the scientists globally agree that we need nuclear to reach net zero. So that's why I'm actually reflecting of that consensus building process as opposed to my any personal opinion. If we could do it without nuclear, great. I would love that. I'm not a fan of nuclear, but I think given the landscape right now, and in terms of how we're going to transition to renewables fully, nuclear does have a role to play in that transition. So that's where I stand on nuclear. I think that's where the science community stands on nuclear. I think it's safe to say that as a consensus. Okay, and I can share the report on that too, which was an op-ed that I wrote in The Hill. I can give you the op-ed in The Hill, and then from there you can get the report. Okay, so, and what to do personally. I think the one thing that there's a lot of answers that you'll hear from different groups, right? So one is, the typical recycle more, make sure you know where your food is being sourced from, reduce your energy consumption, change your energy consumption to renewables as it becomes available. Don't have pets. You will hear things like that. Don't have pets. Pets require pet feed. All of this is very straining for food and agriculture sector, which we need to massively overhaul. Have one less child. Obviously, population increasing is putting a strain on our resources. All of these, there's a lot of kind of like the checklist of things that we can do. The most impactful being probably have one less child, have one less pet. From there on, be smart about where you live, be smart about where you're sourcing your food from. Local, seasonal is the way to go. Definitely making sure that your energy is coming from renewable sources. Here's what I'm going to add to that list that you've probably heard many times. Oh, and thank you to Roshni who found that. Yes, thank you. I was really trying to do that at the same time, unsuccessfully. What I would add to this is radically calibrate your perceptions and the reality of the risks that we face. So we are plagued with innate biases. It's how our brains are wired. We fall prey to stimulus in the environment that has nothing to do with the reality of the risk that we're facing. The reason people think shark attacks are more serious than they are, that planes crash more than they do, that terrorist attacks occur more than they do, is because they're so sensational, they're so salient, and the media covers them. It makes it more available cognitively to us, and we prescribe more frequency and probability of that particular risk occurring than is actually the reality of that risk. If you look at the base rate statistics of dying or being even maimed by like sharks or plane crashes, it is significantly low and gets a disproportionate amount of time and attention and resources. We have to change that. The more we don't close that gap between what our perceptions are, that actually the risks that affect us versus the reality of what we're facing, like sea level rise, the more we're going to inaccurately allocate our resources, and we don't have the time and we don't have the luxury to do that. So I would charge everyone to radically better calibrate cognitively. So ask yourself, if you're scared of something, truly, if you're scared of something, ask why. Is it because it's actually a realistic fear, or is it because that the media has been putting attention on it for whatever reason? So, and what are things that you should be caring about that you're not paying attention to? Radon gas is the second leading cause of lung cancer after smoking, and people die from that. And the amount of people that even know what radon gas is or test their homes for it is minuscule compared to the reality of that risk. These are the kinds of things we can actually work on better calibrating ourselves. And if we can better become internally calibrated, then we can begin to ask our networks to do the same. So charge your parents, charge your friends, and say, sorry, why are you so scared of sharks again? Use an example. Say, what's more likely to happen? Dying from a shark attack or dying from falling airplane parts? And most people will say shark attack, even though it's like single digits globally, versus falling airplane parts, which is still low, but it kills way more people. It's an example to show how we don't assess risk correctly and how different things play tricks on us, and that is costing us greatly. So if we can become better calibrated as individuals, and then as a community, then we can begin to put pressure on our policymakers to also make sure that their resources are being prioritized with the reality of the risk, which is the planet warming, which is food insecurity, which is water scarcity, which is infectious disease outbreak. So let's individually better calibrate, and check out the TED Talk, and happy to get any feedback from you all on that. But it's yeah, it's very much what I would love to see happen at an individual basis.
Yeah, sounds great. That sounds like a great note to end on. Hopefully we can all take something that we learned from Dr. Chakraborty on this session and go home and recalibrate our perception of what's going on in the environmental movement today. Thanks so much for joining us. This has been really great. I hope people got a lot out of this.
I hope so too. This was awesome. Thank you for having me. And you guys are the hope. And God, really need to stop sounding like I'm 50, but you give me hope for the future. I look forward to seeing what you all do. Please reach out, connect with me on LinkedIn, Twitter, Instagram, and We Don't Have Time. That is going to be an excellent resource for anyone trying to look for opportunities in this space. So look forward to hearing from you. Thank you for having me.
Thank you, Sweta.
Thanks a lot,
Thank you so
everyone.
much.
Bye.
Thanks, Dylan.
Yeah.